long-term condition in which the kidneys gradually lose their ability to filter waste, excess fluids and toxins from the blood effectively. This progressive condition not only increases the risk of complication, particularly cardiovascular related, but can also result in kidney failure if left untreated. Next, what are the symptoms? For example, loss of sleep, weakness of breathing, muscle twitch and cramps, chest pain, high blood pressure that is difficult to control, and change in urination of frequency.
Okay, let's get to know what are the causes of chronic kidney disease. The first one is because of diabetes type 1 and type 2. High blood sugar levels damage the tiny blood vessels glomeruli in the kidneys, this can reduces the kidney's ability to filter waste and causing harmful substances to build up in the body. The second is interstitial nephritis, where a condition involving inflammation of the kidney tubules and surrounding tissues. This is caused by long-term use of certain medications, infections, or autoimmune disease. It affects the kidney's filtering and waste removal functions. The third is urinary tract obstruction. This is caused by enlarged prostate, kidney stones, or tumors. Urine backs up, increasing pressures in kidneys, leads to scarring and long-term damage. The fourth is vesicuratorial reflux, urine flows backward from bladders to kidneys. This is actually common in children, and this disease, repeated backward flow, causes infections and kidney scarring. The last one is poisoning from heavy metals or nephrotoxic drugs. These toxins accumulate in kidneys over time. This actually can damage the kidney tubules and reduce the organ's ability to filter waste.
Okay, first of all, what is the treatment of the chronic kidney disease, which is the kidney transplant? What is the kidney transplant? Kidney transplant is the treatment of choice in patients with end stage of renal disease, as it improves survival and quality of life. Other than that, it can confer an approximately 50% decrease in the death rate when compared with the maintenance of dialysis, and improvement in surgical technique, immunosuppressions, and medical management of patients undergoing kidney transplantation have led this to be recognized as the best method of renal replacement therapy. And with the guidelines from the UK Renal Associations state that the transplantation should be the renal replacement therapy of choice for patients with established renal failure who are considered fit for this major surgery and chronic immunosuppressions. And type of kidney transplantation have two, which is whether living donor or deceased donor. And traditionally, most transplanted kidney have come from deceased heart-beating donor, which is typically ventilated critical care patients diagnosed as brainstem dead, whose circulation is maintained until the organs are harvested. And almost all countries face rising waiting lists, and current transplantation rates meets only 10% of global demand. Okay, the kidney transplantation, of course, it has the procedure itself. So it contains 5 procedures, and first of all, we need pre-operative evaluation. So many factors should be identified during the pre-operative evaluation, not only for risk stratifications, but also for patient optimization and post-operative care. And secondly, when it comes to surgery, kidney transplantation is commonly performed with the patients under general anesthesia, and epidural catheters for the post-operative pain management may also be placed and are a viable option for intraoperative management, maintaining a stable hemodynamic profile with no graft function alteration. And third, of course, after surgery, you need to monitor the patients, and a 5-lead ECG is used to allow accurate ST and dyspnea analysis. Non-invasive blood pressure, which is an NIBP monitoring, is adequate in most cases. Care is taken not to place the NIBP cut-off on the same side as an atrial venous fistula. Invasive blood pressure monitoring is restricted for use in patients with marked cardiovascular compromise in order to protect potential fistula sites. And for the fourth procedure, which is post-operative care. Post-operative care should be on a ward staffed by nurses and clinicians with specialist expertise. The aim is to continue to optimize patient well-being and graft function using protocol-driven regimens encompassing fluids, pain relief, and immunosuppression management. Okay, lastly, which is the immunosuppression. Immunosuppression strategies is aim to prevent graft rejections and form a vital part in the management of renal transplant patients. Immunosuppression regimens vary in different centers, but have traditionally consist of triple therapy with a calcineurin inhibitor and anti-proliferative agent and a corticosteroid. That's all.
So the next is ways to prevent the disease. The first one is to maintain healthy kidney function. It is important to follow a kidney-friendly diet that is low in sodium, saturated fats, and added sugars, while including plenty of fruits, vegetables, and whole grains. Additionally, protein intake should be limited if recommended by your doctor. The second is it is important to get regular kidney function tests, especially if you have diabetes, high blood pressure, or a family history of kidney disease, as early detection and can help prevent further damage. The third is exercising regularly is essential for maintaining good kidney health, as it helps control weight, blood pressure, and blood sugar levels. Aim to engage in at least 30 minutes of moderate physical activity on most days of the week. The last one is avoid smoking and limit alcohol consumption, as smoking reduces blood flow to the kidneys while alcohol can increase blood pressure and lead to dehydration.
For conclusion, a kidney transplant is a life-saving treatment for end-stage renal disease, offering significantly better quality of life and survival rates compared to dialysis. Advanced in immunosuppressive therapy and surgical techniques have improved outcomes, minimizing the risk of organ rejection and infection while restoring kidney function. Additionally, preventing chronic kidney disease involves adopting a healthy lifestyle that includes a balanced diet, proper hydration, regular physical activity, and effective management of blood pressure and blood sugar levels.